So the question is, why science? It's a good question. As you look at science and scientific discovery, there's so much that we don't know. And most of the time, when we think we found something, it oftentimes brings up many, many more questions than it actually answers. And I think it's the quest sort of for that knowledge piece, to try to understand what's going on around you and try to not just understand it, then maybe eventually take that information and try to help people. I think that's sort of the major drive. You know, if you'd asked me when I started all of this, if I was going to do a startup company, like I would have looked at you like you were crazy, right? I didn't know how to do a startup company, right? You know, I was here doing science, and I was the most interested in as a physician scientist, and interested in cardiovascular disease and its origins, and interesting, you know, looking at targets in mitochondria. It just sort of, you know, developed organically. I think that we had this finding, and it was something of might be of therapeutic interest. It's that work that's ultimately led to a spin-off company for the development of a drug. So Sanacor, a small peptide, this was what was discovered here, has the ability, we think, to reduce the risk of or delay the development of small and large vessel disease in people with diabetes. But it may also have effects, given the pathway it's looking at, it may also have potential favorable effects in people with neurodegenerative diseases and potentially some cancers. Yeah, well, I'd say that the institution has been very supportive. The institution, I think, also recognizes that this is an important path to encourage our investigators to do, because it really helps us move towards a lot of these great ideas we have in fundamental science, to move them towards, or more towards, sort of impact on human health. And sometimes that's, and I'll say that can be scary, right? Because you're doing things that you weren't trained to do. Like, I wasn't trained as a medicinal chemist or as, you know, a drug developer, right? You learn some things on your own. You also pick up some, you know, collaborators and who have different skill sets, and you get connections to other people who have other skill sets to be able to execute, you know, a plan. The question is, how important are the various pieces of the sort of biomedical enterprise to drug development? I mean, I think they all sort of work in concert together. I would say in general, again, these are generalities, that, you know, government funding, NIH funding, right, is critically important for that discovery science and for sort of the finding new targets and finding novel therapeutics, right, and finding sort of what things might be of interest that no one's really thought about, right, or discovering the new pieces and new biology that ultimately become biomarkers or therapeutics, right? Where big pharma tends to come in is they are really good at executing large, you know, at volume and at scale, right? And they can take some of these ideas and concepts that have been fleshed out a bit, right, in smaller companies or even within academia directly, and take them and run them at scale, some of these studies, in a very fast manner to move them faster to clinic than you might see sort of in an academic setting. All the portions are needed, I think. If you lose the academic portion of this, where you're seeing a lot of discovery, you're going to see a significant hit to sort of the new drug development, biomarker development, things like those, because most of that's coming out of labs, like you see here. And so it's critically important that, you know, we keep that going.